All right, Jonathan, we're live.
Hi guys, it's Jonathan here, the esthetician with Dr. Jason's Emer's practice. And right now we're getting ready to do one of our treatments for pigmentation that helps with any kind of scarring, texture issues on the skin, any sun damage, fine lines and wrinkles. Right now I am occluding the area.
What does occluding mean?
Just blocking the peel from hitting those areas to kind of reduce the peeling process in the corners of the mouth, the corners of the nose that tend to be a little sensitive for some clients. Tuck in your lip, please. Okay, perfect. So we're getting ready to do the Cosmelan solution. So we are about to use the degreasing solution to lower the pH in the skin so we can get better penetration from our active, which our peel is going to be doing the exfoliation process. So Cosmelan is going to be a mask that she's going to leave on her skin for about 8 hours.
What is the healing process like for Cosmelan?
Downtime is about, everyone's different, but I've seen it go anywhere from 5 to maybe 8 days. But you know, here at the practice, we like to incorporate a lot of our oxygen facials. We have the hyperbaric chamber that kind of speeds up the healing process. So if there's a lot of redness, you know, we recommend different alternatives. But usually downtime is about 5 days, regularly.
Can you tell us again what you're doing right now?
I am degreasing the skin, just kind of getting rid of all the oil that may be on the skin so we can get better penetration from our mask. Doing okay?
Yes.
Perfect.
How did that feel?
It felt
Active?
like
Degreasing
alcohol,
solution, yeah. Like really medical, right?
It didn't sting.
Yeah, that's good. Yeah, that just that's the oil degreasing solution.
It was pleasant. It didn't hurt.
Yeah, good.
Good.
What do we have here? So here we have our magical solution, which is our Cosmelan.
Can you show us again what it looks like over here? Oh, perfect. Looks like peanut butter. And so what are the ingredients in Cosmelan?
So you have about 5 main lighteners on the skin that help fade it. So you have your kojic acid, azelaic acid, arbutin, which are tyrosinase inhibitors that exfoliate the skin and help to even out the skin. So this is our typical procedure for any kind of, you know, laser, any type of exfoliation that anyone does with Dr. Emer. We always like to prep the skin with a pretty good exfoliation.
And why is that important?
Just because you get rid of all the dead skin cells and you're working on a much smoother and cleaner skin.
And can anybody do this treatment, or does it have to be before any laser?
We could do it every single skin type. We could do all the way from 1 all the way to 6. So the lighter skin all the way to the most darkest of skin. Doing okay?
Yes.
Perfect.
Thank you.
What if I wasn't going to get a laser treatment? Can I still do this?
Of course, of course. If you have any acne scarring, if you have any sun damage, any PIH, which is that horrible post-inflammatory hyperpigmentation we get after a little pimple or a little breakout.
And how does this feel?
It feels cold, slightly
Okay.
cold.
Can this work for someone who has eczema on the skin?
We would have to make sure that it's not inflamed and you have it under control.
Yeah, if you guys have any questions like that, we would love to see you first before we advise any treatments.
Tucking your lip.
What is the downtime like?
Downtime is anywhere from 5 days to maybe 8 days.
And-
Everyone's different.
And what can she experience during this downtime?
The second day is gonna feel maybe like a pretty bad sunburn. The third day is when the skin should just feel a little tighter. The middle of the third day is when it should kind of start to peel and kind of lift off, and she will peel from there.
And then what happens after she peels?
We have smoother and flawless skin. So right after that, we're going to be doing a laser just to kind of help increasing that collagen and kind of just plump up the skin and give it more of that smoother finish. What this is basically doing is this is exfoliating the top dead skin cells from the skin to kind of get underneath to that smooth surface that we.
Can you tell us again what treatment is this?
This is our Cosmelan treatment for pigmentation, melasma, sun damage, scarring. It's a great way to kind of prep the skin before any kind of laser treatment we're doing here with Dr. Emer.
Does this Cosmelan have hydroquinone and retinol on it?
You have the option to have it with or without.
And can anybody do this treatment?
Yes, everyone could do this treatment. Every single skin type. Skin type 1 to all the way to skin type 6.
Do you feel anything coming from the Cosmelan?
Doesn't
No heat.
Slightly chill. No.
Yeah. Everyone's different, but there should never really be any kind of heat or any kind of discomfort when applying any of the chemical peels we do here at the practice. If you really know what you're doing, that's when you're going to get the best result.
And she's going to peel after this, correct?
Yes, she will peel.
Somebody's saying that you already have beautiful skin.
Thank you.
Oh. Thank you.
We're going to make it better. We're going to improve the collagen texture. Do we have any questions?
No?
Perfect.
And how long is she going to leave this mask on again?
For about 8 hours.
8 hours, and then how will I take it off?
With water, just cold water. Yeah. Lukewarm.
Okay.
Could she just jump in the shower and wash it off like that?
Yeah, she can.
Does this work for post-pregnancy pigmentation?
Of course, yes. It helps with that colasma that happens after any kind of pregnancy. Could also happen from taking any type of birth control or any type of antibiotic. Sometimes, pigmentation is caused many different ways, but to target any kind of pigmentation coming from pregnancy, yes.
How often would you suggest you can do this?
You probably do this maybe 2 times, 3 times a year, every 3 months.
And can you have an allergic reaction from this?
Only if you're allergic to, very specific ingredient in the formulation. Yeah, if you're allergic to mushrooms or something like that.
Should you avoid the sun after getting this treatment?
Yes, you definitely would want to avoid the sun completely. No heat, no steam, no type of hot yoga. because that tends to stimulate the melanocytes in the skin.
Can this be done on men?
Yeah, men and women can do this, and you can literally do this from head to toe to target any area that has any type of discoloration. Any darkening on the arms, the legs, the back, the inner thighs. This is very popular. Yeah, you can pretty much do it everywhere. Anywhere where there's any kind of discoloration.
If you guys want to know how you can get this treatment, please send us an email to appointments@jasonemermd.com and we can set you up with a consultation.
Yeah, and then she will be going home with our post-procedure mask, which is the crystal fiber mask that's going to help reduce more of the redness, increase the moisture, and increase the hydration within the skin. So maybe post 4 days, that's when she's going to be up doing that mask.
Oh, no problem. Happy birthday. Is this peel safe for darker skin tones?
Oh yes, we could do Fitzpatrick's 1 to all the way to Fitzpatrick's 6. So anywhere from to lighter skin types to the most darkest of skin. The most important thing is to really go to, a practice that really knows the complete steps on how to do the Cosmelan, and that's where we're experts here.
If you guys want to know the pricing, please send us an email to appointments@jasonemermd.com to set up a consultation.
How do you know when you've applied enough of the peel to the skin?
Oh, we're using the entire jar.
Oh wow.
Yeah.
Anytime. We have treatments for dark circles. Make sure that you send us an email so we can set you up with the best treatment for your skin and your concerns. Anytime.
What is literally in a peel that'll penetrate and treat the skin?
You have the kojic acid, azelaic acid, all the main lighteners that are out in the market to kind of help fade away the pigmentation. This treatment has been around for about, I would say about 15 years now in the market, and it's known to be the best one. But what the most important part is that here, you need to combine it with some lasers or some exfoliation right after to kind of keep on boosting the results. And then the areas that are most affected are the areas that we apply a heavier coat on.
This is the Cosmelan facial peel actually, but it does look like peanut butter. Jonathan, one last time, one quick recap.
So right now we are doing the Cosmelan treatment, which is our solution for pigmentation and melasma. And this is prepping the skin for one of our laser treatments that she's going to be doing.
All right.
This may be done in every single skin type. Skin types 1, which are your most lighter skin types, and skin type 6, which is your most darkest skin types.
All right, Jonathan, we'll let you finish this treatment. Thank you so much for showing us.
Come check us out. Thank you.